again, health enthusiasts. Today, we're going to dive into a topic that might not be on everyone's radar, but is extremely important: metabolic syndrome. Have you ever heard of it? If not, you're not alone. It's often an overlooked condition, but it carries some serious implications for your health. Metabolic syndrome is essentially a cluster of conditions that increase the risk of heart disease, stroke, and type 2 diabetes. The scary part? It's more common than you might think. According to the American Heart Association, about 1 in 3 adults in the U.S. has metabolic syndrome. That's staggering. But here's the good news. With the right lifestyle changes, metabolic syndrome is preventable, manageable, and even reversible. That's right. You have the power to take control of your health. In this video, we're going to unpack what metabolic syndrome is, how it develops, and more importantly, how you can combat it effectively. Welcome to our channel, Lifeline Updates Health, your lifeline to all things health and wellness. So, are you ready to take charge of your health and learn about metabolic syndrome? Let's dive in. Imagine your body is like a finely tuned machine. Everything is working in harmony. But what happens when things start to go haywire? That's exactly what occurs with metabolic syndrome. To break it down in simple terms, metabolic syndrome refers to a group of risk factors that occur together and increase the likelihood of developing heart disease, type 2 diabetes, and even stroke. These risk factors include high blood pressure, high blood sugar, excess body fat around the waist, abnormal cholesterol or triglyceride levels. In other words, metabolic syndrome is like a storm brewing in your body, with multiple warning signs that things are not quite right. But how does this happen? One of the key culprits is insulin resistance. Normally, your body uses insulin, a hormone produced by the pancreas, to help glucose enter your cells, where it's used for energy. Think of insulin as a key that unlocks the doors to your cells. However, in metabolic syndrome, this key doesn't work properly. As a result, glucose lingers in your bloodstream, leading to high blood sugar levels. The pancreas tries to compensate by producing more insulin, but over time, the system becomes overwhelmed. This is the foundation of insulin resistance, the hallmark of metabolic syndrome. But that's not all. This insulin resistance sets off a domino effect. High insulin levels encourage fat storage, particularly around the abdomen. The fat cells themselves become inflamed, releasing harmful substances that can cause even more health issues. Over time, this inflammation and fat accumulation contribute to conditions like heart disease and type 2 diabetes. The 5 key markers of metabolic syndrome. Let's break down the 5 critical markers that doctors use to diagnose metabolic syndrome. If you have 3 or more of these risk factors, you may be diagnosed with metabolic syndrome. 1. Abdominal obesity. Abdominal obesity is often the first warning sign of metabolic syndrome. If your waist circumference is over 40 inches for men, or 35 inches for women, you might be at risk. But why is abdominal fat particularly dangerous? It turns out that fat stored around your waist, known as visceral fat, is different from fat in other parts of your body. Visceral fat is located deep within your abdomen, surrounding your internal organs. This type of fat is considered metabolically active, meaning it can produce hormones, metabolites, and inflammatory molecules. These substances increase inflammation throughout the body, affecting everything from your cardiovascular system to your liver. Studies have linked visceral fat to a higher risk of conditions like cardiovascular disease, liver disease, respiratory problems, and joint pain. It's also been shown to increase the likelihood of developing metabolic syndrome and type 2 diabetes. So, while belly fat might seem like a cosmetic issue, it's much more than that. It's a red flag for your metabolic health. 2. High blood pressure. The second marker is high blood pressure, defined as readings of 130/85 mmHg or higher. You might be wondering how blood pressure is connected to metabolic syndrome. Well, insulin resistance doesn't just affect blood sugar. It also impacts a hormone system that controls blood pressure and fluid balance. When this system is overstimulated, your blood vessels constrict and your body retains sodium, both of which increase blood pressure. High blood pressure is a silent killer. Over time, it can damage your arteries, making them less flexible and more prone to plaque buildup. This can lead to serious conditions like atherosclerosis, increasing your risk of heart attacks and strokes. Monitoring your blood pressure is critical, especially if you're dealing with other markers of metabolic syndrome. 3. Elevated blood sugar. The third marker is elevated blood sugar, particularly fasting glucose levels of 100 mg/dL or higher. This is a sign that your body isn't managing glucose effectively. While blood sugar naturally rises after eating, it should return to normal levels within a few hours. However, if you're insulin resistant, your body struggles to bring blood sugar back down. Chronically high blood sugar damages the blood vessels and nerves over time, leading to complications like heart disease, kidney damage, and vision problems. This is also the gateway to type 2 diabetes, a chronic condition that affects millions of people worldwide. Monitoring blood sugar is crucial, and home blood glucose monitors can be a valuable tool for tracking your levels. If you notice consistent elevations, it's essential to consult with your healthcare provider. 4. High triglycerides. Triglycerides are a type of fat found in your blood, and elevated levels are another marker of metabolic syndrome. If your triglyceride levels are 150 mg/dL or higher, it's a sign that your body is struggling to manage fat. When you eat, your body stores excess calories as triglycerides, and these are later used for energy between meals. However, when triglyceride levels remain high for extended periods, it increases your risk of heart disease. High triglycerides are often linked with other conditions like insulin resistance, low HDL, good cholesterol, and high LDL, bad cholesterol. You can monitor triglyceride levels through routine blood tests, and if your levels are elevated, lifestyle changes such as diet modifications and exercise can help reduce them. 5. Low HDL cholesterol. Finally, we come to low HDL cholesterol, also known as the good cholesterol. HDL helps remove other forms of cholesterol from your bloodstream, transporting them to the liver for excretion. If your HDL levels are below 40 mg/dL for men and 50 mg/dL for women, it's considered low. Low HDL levels are a red flag because they indicate that your body isn't effectively clearing out cholesterol, which can lead to plaque buildup in the arteries. This increases your risk of atherosclerosis, heart attacks, and strokes. Just like triglycerides, HDL levels can be monitored through a blood test, and lifestyle changes can improve your numbers. So what happens if metabolic syndrome goes unchecked? Unfortunately, the consequences can be severe. First and foremost, metabolic syndrome dramatically increases your risk of developing cardiovascular disease. The combination of high blood pressure, high blood sugar, and abnormal cholesterol levels creates a perfect storm for damaging your arteries and heart. Over time, this can lead to heart attacks, strokes, and heart failure. But that's not all. Metabolic syndrome is also a significant risk factor for developing type 2 diabetes, a chronic condition that occurs when your body can't effectively manage blood sugar. Diabetes itself brings a host of complications, including nerve damage, kidney disease, vision loss, and increased risk of infections. Another potential consequence is non-alcoholic fatty liver disease, NAFLD. When your liver stores too much fat due to disrupted metabolism, it becomes inflamed, leading to liver damage. NAFLD is increasingly common among people with metabolic syndrome and can progress to more severe liver conditions like cirrhosis if not addressed. Women with metabolic syndrome are also at a higher risk of developing polycystic ovary syndrome, PCOS, a hormonal disorder that can cause irregular periods, excess hair growth, and infertility. Obesity and insulin resistance are significant contributors to PCOS. Lastly, metabolic syndrome can contribute to sleep apnea, a condition where breathing repeatedly stops and starts during sleep. This not only affects the quality of sleep, but can lead to daytime fatigue and other health problems. Now for some good news. Metabolic syndrome can be managed and even reversed. The key is making targeted lifestyle changes that address the underlying causes. Here are some crucial steps to take. 1. Focus on a balanced diet. A healthy diet is the cornerstone of managing metabolic syndrome. Aim for a balanced diet rich in whole grains, fruits, vegetables, lean proteins, and healthy fats. Whole grains, such as brown rice, quinoa, and oats, are packed with fiber, vitamins, and minerals. They help regulate blood sugar levels and support digestive health. Similarly, eating colorful fruits and vegetables provides essential antioxidants and phytonutrients that fight inflammation and support overall well-being. Incorporating lean proteins like chicken, turkey, fish, and plant-based options like beans and lentils will give your body the amino acids it needs without the added saturated fats often found in red meat. Healthy fats, particularly omega-3 fatty acids found in fatty fish, flax seeds, and walnuts, are anti-inflammatory and can help improve cholesterol levels. One diet that has gained popularity for its effectiveness in managing metabolic syndrome is the Mediterranean diet. This diet emphasizes whole foods, olive oil, fish, and plant-based meals while limiting processed foods and sugars. Studies have shown that adopting the Mediterranean diet can significantly reduce the risk factors associated with metabolic syndrome. However, no single diet works for everyone. It's important to find a nutrition plan that fits your preferences and lifestyle while prioritizing healthy, whole foods. 2. Exercise regularly. Exercise is a powerful tool in combating metabolic syndrome. Engaging in at least 150 minutes of moderate intensity exercise per week, such as brisk walking, swimming, or cycling, can help reduce insulin resistance, improve blood sugar levels, and promote weight loss. Strength training exercises like weightlifting or bodyweight exercises are also beneficial. Building muscle helps increase metabolism, improve glucose uptake, and support fat loss. Studies have shown that even small increases in physical activity can have profound effects on health. For example, walking for just 30 minutes a day can lower blood pressure, improve cholesterol levels, and help with weight management. The key is finding an exercise routine that you enjoy and can stick to. Whether it's dancing, yoga, hiking, or even gardening, moving your body consistently is what matters most. Metabolic syndrome might sound like a daunting diagnosis, but remember, it's not a life sentence. With the right lifestyle changes, you can manage and even reverse many of its effects. By focusing on a healthy diet, regular exercise, and monitoring your health markers, you're taking proactive steps towards a healthier future. Let's all take this opportunity to prioritize our health, make informed choices, and be mindful of our bodies. Small changes today can lead to significant improvements in the long run. If you found this video helpful, check out our video on 10 daily habits that's secretly expanding your belly. See you in the next video. Stay healthy.